This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
People say, oh, this work must be so depressing, Emma. And I'm like, it is the absolute opposite. I have never done more fulfilling, joyful work in my life. When people are supported in the very toughest moments, when their mom is dying, when their husband has dementia, when their child has died, when their baby is stillborn, when people are supported and someone will actually speak to them directly about what they're experiencing, they are so grateful and appreciative.
This is the Heart of Hospice podcast with Helen Bauer. Emma Payne from HelpTexts is my guest today. Whether you're a family caregiver or an end-of-life professional, the Heart of Hospice podcast is here to enhance your hospice experience by connecting you with information you can use about end-of-life care.
This episode of The Heart of Hospice is sponsored by Odonata Care. When caring for a loved one on hospice, support becomes essential. Introducing the Care Plan, a path to comfort for the hospice patient, a supportive guide by experienced hospice nurses Nancy Hireman and Brenda Kazire. Nancy and Brenda invite you to experience all that the Care Plan has to offer. Be sure to check out their free library of care videos on thecareplan.net or on YouTube. Purchase your copy of the Care Plan today at thecareplan.net. This episode of the Heart of Hospice podcast is sponsored by the Tree of Life Conference by International Doula Life Movement. Join IDLM at the Tree of Life Conference in San Antonio, Texas, November 1st through the 4th. The Tree of Life Conference is more than just workshops and seminars. It's an opportunity to connect, learn, and renew your commitment to compassionate care. Attendees will hear from expert speakers like end-of-life educator Barbara Carnes and Death Deck co-creator Lisa Paul. Visit internationaldoulalifemovement.com for more details.
Man, this interview is like the onion. There are a lot of layers to it, and we peeled them all back. My guest today is Emma Payne. She is the founder and CEO of HelpTexts, which is a game-changing business that delivers ongoing, accessible, expert grief and mental health support globally via text message. Every single day, Emma combines her own personal grief experience and her more than 25 years in the tech space to provide people with thoughtful, practical support that really works, and it goes straight to their phones. You're going to hear the story of how she started HelpTexts. It's pretty amazing. They provide these text-based messages of hope and encouragement and support to people who are grieving and to the people who are supporting the grievers. You're going to hear Emma tell the story of what motivated her to create HelpTexts and how this service has helped her find healing from her own grief experience. HelpTexts reminds people who are supporting those who are grieving that it's not as important whether you say the right thing or not, but that you're present for the person who's grieving. We're also worried about saying the wrong thing, about putting the grief foot in the mouth. We've all done it. The content of the texts are written by expert contributors who have experience and training about grief and end of life. It's people like Gabby Jimenez of the Hospice Heart, Barbara Carnes of BK Books. She's the person who wrote Gone From My Sight, the little blue book that we use to support end-of-life caregivers all over the world, Lisa Paul of the Death Deck, and Megan Devine. HelpTexts also provides text-based support to healthcare professionals who serve in emotionally charged environments to help them deal with compassion fatigue and burnout as well. We want our listeners to know that HelpTexts is offering a $10 discount code for you to access. When you sign up or purchase a gift subscription at helptexts.com, just use the code The Heart of Hospice, and you'll receive that $10 discount code. You'll also find a link to the code and the website in our show notes, so you'll be able to go in there and not just access HelpTexts and the support that they offer, but get your $10 off as well. So here's my conversation with the amazing Emma Payne. Emma, welcome to the Heart of Hospice podcast.
Thank you so much for having me. Glad to be here.
Well, we've waited a long time since we talked last to get you on the show. I'm so glad to have you with me. So let's get to know you just a little bit with an icebreaker question that I did sneak peek this with you just a little while ago before we started recording. So you've had a chance to think about it. What's your go-to habit for self-care right now?
Yeah, this one doesn't require me thinking about it. Has always been punk rock. I play bass in a band.
What?
And for me, loud music is the way to, let it all out.
But you actually play in a band.
Yeah.
Oh, that is so cool. Want
to know the band name? It's hilarious, I think.
Yes.
Hot Flash.
That is hilarious. So is it I hate to say this, is it a bunch of middle-aged ladies?
Half guys, half girls. My band in Seattle for 8 years was called the Control Tops, which was also half and half.
Oh my gosh. Now, younger listeners aren't going to get that. But if you've ever worn pantyhose, if you're an older lady and you've had to wear pantyhose like I did when I was younger, you'll know what a control top is. Yeah. Oh my gosh, that's hilarious. So the hot flash?
Hot Flash, yeah. I mean, Hot Flash, our first drummer was 26 and he still thought the name was cool. So we're like, all right, we'll go with it then.
Listen, if you can get a 26-year-old male drummer to think that name is cool, you're good to go. Oh my gosh. Emma Payne, there are many layers to you. Well, I'm interested in this conversation now. I'm hoping more of this comes out. This is pretty good. Okay. So now I've got to redirect myself. That's hilarious.
Now the serious stuff, huh?
Yes, we're going to get into serious stuff.
Serious.
It is serious stuff, but it's great stuff. You guys are doing some fantastic work. We're talking about HelpTexts today. It's hard to say, but easy to remember and a great service. So how did HelpTexts get started?
Well, in 2015, my friend died. This was my first time being bedside with somebody when they died, and he had asked me if I would speak at his funeral, which of course I agreed to do. But it was a very daunting ask once he died, and I really realized I was going to be flying across the country and standing in front of upwards of 200 people who I had not heard from when my husband died by suicide a decade prior, because my friend and my husband were best friends, also second cousins. So it was a lot of the same people. So I did that and delivered the eulogy. And I essentially spent the whole funeral weekend, all the way through the pub night, talking to college friends, aunts, uncles, and hearing some version of, "I'm so sorry I didn't reach out back then, Emma. I didn't know what to say."
Yes.
I probably heard that same thing 100 times. And on my plane ride home, and at this point, I'd already spent 20 years building web and mobile applications for all kinds of things, suicide prevention, caregiver support, youth voter registration. So I had lots of experience in web and mobile. And on my plane ride home from the funeral, I just thought, this is bananas. I mean, this is ridiculous. I spent 10 years not hearing from people. And Barry and I had been together from when I was 19 to 31. So, I mean, this is my whole life. of friends and connections and, aunts, uncles, and so on. So I spent 10 years not hearing from people. And because Barry died by suicide, I think I became very proficient at inventing reasons for why that might be, why I wasn't hearing from people. But equally, at my friend's funeral, I essentially realized that 100 people spent that same 10 years genuinely feeling badly. Like they really did care about me and they really didn't know what to say. And then they said, more time passed, then I felt more embarrassed that I hadn't reached out and I was worrying about you. Yeah. And then I felt guilty. So on my plane ride home, I'm like, okay, what can we do about this? And I mapped out what became HelpTexts. Could we just text people grief support and also text their friends and family tips and suggestions for how to help them? Seems pretty straightforward. Mapped the whole thing out on my plane ride home. Landed at SeaTac, assuming that when I got on Wi-Fi, I would see that there were already lots of different grief support tools out there, but there weren't. So started building HelpTexts back then, 2016.
Wow.
The things you can do on a plane ride,
Oh, I'm telling you. Well, because you're completely disconnected from everything, right?
Completely disconnected.
Your brain can work. I love that. The first thing that hits me from your story is you have created such meaning out of, what was a crappy situation for you to go years. And your friends didn't really mean to abandon you. It just gets super awkward and then they feel guilty and that just makes things more awkward and nobody knows what to say. It's just an amazing thing that you would create a business and create it. To me, that's making meaning. That's meaning making from such a hard event.
Yeah, it's been very, very meaningful for me. I credit HelpTexts as being a critical part of my healing for sure, but also we help people all day, every day. We just see feedback coming into people say, oh, this work must be so depressing, Emma. Yeah. And I'm like, it is the absolute opposite. I have never done more fulfilling, joyful work in my life. When people are supported in the very toughest moments, when their mom is dying, when their husband has dementia, when their child has died, when their baby is stillborn, when people are supported and someone will actually speak to them directly about what they're experiencing, they are so, so grateful and appreciative. So 99% of what streams into our subscriber support portal is thumbs ups and hearts and thank yous and this is really helpful and I'm going to try that. Like, what could be more healing and meaningful than that? So yeah, I'm very proud of what we're doing.
That's amazing. Amazing. So I want to touch back on something that strikes me. So you told your friend before he died that you would be happy to do his eulogy. That you would be fine with that.
Because when you're actually bedside with someone who's dying, you say yes to everything.
Oh, yes. I want you to learn to be a trapeze artist and try out for Cirque du Soleil. Of course, I'll do this for you.
I am going to be so good on that high wire. Yeah,
sure.
Absolutely.
But most people will tell you, when polled, they would tell you that they fear dying less than they fear speaking in public. Public speaking ranks higher on the fear meter than dying, actually.
Really? That's odd, but believable.
I don't know. If we were having this conversation and there were 200 people on the Zoom call, I think I might have some public speaking anxiety. So to take this commitment that you made to your friend and then a huge crowd with your grief, wow. What an amazing gift you not gave to him, but a gift that you gave yourself and this commitment to your friendship.
I say all the time that it was my final gift from him. I mean, if I hadn't done that, I would have spent another 10, 20, 30 years not hearing from people and imagining all kinds of, imagining that they hated me or they thought the suicide was my fault or they didn't care. But instead, he invited me into a space that gave me the opposite information.
Isn't that sort of what we do when there's a void of communication? We create the story in our own heads.
Yep.
Yeah.
It's one of the reasons that grief is so isolating and caregiving. It's a very it's just a very isolating experience, and we create narratives because people aren't talking to us about our husband who died by suicide and remembering how hilarious he was when he was snowboarding at Whistler, and that leather jacket that he customized with the Ramones. Like no one's talking about it. So you invent things.
Sure. You fill that space with your own thoughts and your own assumptions about what people are thinking.
Mm-hmm.
Yeah. They think I did something wrong. Well, maybe I did do something wrong.
Mm-hmm.
Yeah. What do you think about this grief shaming conversation that seems to be happening? I read posts about this all the time, about how there's so many things that are on the list of things we shouldn't say, that we're just really bad about it. And I think sometimes that's crippling for people. They're so worried about saying something that's on that list of the top 50 things you should never say to someone who's grieving. What do you think about that?
Yeah, I think this is a really important topic, Helen. At HelpTexts, we actually have a part in our user manual, in our style guide, that says that we will not talk about things not to say. The problem is the opposite, that we're nervous to say the wrong thing. So making people even more nervous that there is a wrong thing, I think really does a disservice. We actually send a text out right at the beginning, because we're texting both the grieving person and the friends and family who care about them. We have an opportunity at the beginning to say, there is no wrong thing. If you are present and saying even nothing, it's better than silence, Lean in, be available, just listen if you're not sure what to say. We can't be so nervous about saying the wrong thing that we stay away. I mean, that's exactly what led to my own experience, right? People were so worried about saying the wrong thing that they stayed away.
Yes, it's so uncomfortable that we just avoid it.
And silence and absence are what really hurt when we're both caring for someone at end of life and grieving.
Yeah, I think that's probably more painful for the griever than if you say the wrong thing.
Absolutely.
So say you said, I'm sorry for your loss. Okay.
Yeah. And we also text messages to the grievers saying, if someone puts their foot in their mouth and says something goofy, here's a way to think about that. Remember that they're trying and that it's new for them as well.
Right, right.
Think of the intent as opposed to the impact in the moment.
Yeah, the actual implementation of it.
Yeah. I remember at Barry's funeral, someone said, well, I guess you should just not do things that make you think about him. It's like, okay, so I'm going to stop, brushing my teeth or seeing the color blue, for example.
Or living in my own home.
Or living in my own home, or going in my room, or anything.
Or breathing, eating a meal.
Breathing. So on the one hand, it seemed hurtful in the moment. On the other hand, it was someone who had arrived, traveled to a different city to be at the funeral in a time that was really scary and was not sure what to say. And that's what they said. So what do I think about what that actually felt like to me, or their presence and availability, and that they tried?
Yeah. Because as a griever, if you were to sit there and just make a laundry list of all the crappy, stupid stuff that people said to you, wow, what?
And people do that all the time, and I'm just not sure that it's a great service. If we want to,
it's not helpful.
If we want to be stronger together, if we want to feel able to support our communities and the people we love, then we need to be able to just speak, right?
I agree.
Or not speak, just sit and listen. That's also
just
fine.
The presence, like you were saying, have some presence. So let's get down to brass tacks on HelpTexts. How does it work, and how can people access it?
Yeah, great. Thank you. So we deliver a full year of personalized messages for caregivers and grievers, personalized based on things like diagnosis, age, relationship, cause of death. So if you're caring for your husband who has Alzheimer's, you'll get messages about caring for a partner with Alzheimer's. If you're grieving a child who is stillborn, you will get text for grieving a stillborn child. The messages are deeply evidence-informed, rooted in current theoretical models of grieving. So this is deeply expert stuff. We work with 80 different world-leading experts across the country to craft messages that are both thoughtful and empathetic, but also practical. It's texts. They're short and sweet. They come to you all year long. You can stop and start anytime by texting back stop and start. We have a 95% acceptability rate across all of our research, which is absolutely incredible. 95% of the people that get our texts say that they find them helpful and that they feel less alone. We're in all 50 states. We have subscribers in all 50 states as of last year and 44 countries. We're available in lots of languages. And the best thing about it, honestly, is that they work. It works. People like to get simple, digestible tips and advice straight to their phone. It's not overcomplicated. It's a low threshold to begin. About 20% of our global subscriber base are men. But when we ask men to complete surveys about the service, they love it the most, even higher than the 95%.
Oh, wow.
It's practical, personal, comes to you, curated based on the experiences that you're having, and people just like to have their person remembered. So we're texting the caregiver and the griever, but also the friend's family, boyfriend, people who want to help and might not be sure how. We have for example, we had a young subscriber, Sarah, whose dad died when she was in her 20s. She signed up to get texts. She added in her then boyfriend, now husband, as a supporter. So she was getting tips and suggestions for how to process her dad's death. He died of cancer. And she says, I don't know what you texted him, her boyfriend, but I know that on my dad's birthday, he made a reservation at dad's favorite restaurant and asked me to share my favorite stories about him.
Oh my gosh.
And so for her, it was a completely life-changing shift that she was finding ways and opportunities to integrate her grief into her life and to make meaning from it and be able to talk to him and so on. And we asked her if we could reach out to him and ask what he thought. And he was basically just relieved. He's like, look, I love her. She's crying all the time. Nothing I'm doing or saying is helping. So thank you for telling me what to do. Just like a very basic sort of practical response. Like, thank you for telling me what to do. I don't know what to do. So thanks for telling me. So that's how it works. We're texting the caregiver, texting the griever, and also the people who want to help. We have support for also pet loss, pregnancy loss, and we also have a really beautiful service for healthcare workers experiencing fatigue and burnout with grief literacy, scripts for talking to families after a patient has died, things like that.
I really like that. Right. I'm biased, right? I work on that side of things. There are so many different aspects to HelpTexts that are amazing. Do you have to have a recent loss, or is it a service that could be utilized for someone that you lost, 20 years ago, 30 years ago?
Somebody signed up yesterday for a loss that happened 33 years ago, which I think might be our longest timeline. So when I first was mapping this out on the plane ride, I naively assumed that people would sign up when someone died. 34% of our subscribers do sign up in the first 2 months. So we are very good at supporting people in those early acute months after a loss. However, people sign up at all kinds of times, 2 years, 3 years, 5 years, 10 years after the loss, like whenever they realize that they could use some extra help and some ways of processing their feelings. We work with Hope Edelman, who writes about long ago losses and have a whole series geared for people who are at least 3 years past the loss. And we also work with people like Megan Devine, and Gabby, who you just interviewed, to write about those early months as well.
So your content is coming from a lot of different contributors, and you named a few of them, Gabby Jimenez of the Hospice Heart. Tell me some of the other people that are content contributors, because you've got some amazing people that are working with HelpTexts. Yeah,
and some amazing hospice people. Lisa Paul, for example, just writes some beautiful texts to help us with messages for people who work in hospice as well. Oh,
yeah, I have my Death Deck swag.
Her mug right there.
Yes, from Lisa Paul.
But I mean, one of my highlight experiences last year was that we started working with Barbara Carnes. So Barbara, as you know, wrote the book, the Little Blue Book, that has sold something like 30 million copies in hospices in the U.S. with just beautiful wisdom for being bedside with someone who is dying. And so we worked with Barbara to craft a whole series of text messages based on the content in the Blue Book. And now it goes straight out to people's phone. And Barbara herself describes it as, she's like, oh, it's like having Barbara in your pocket. I'm like, yes, it is. You're sitting in hospice, right? Your person is dying. You're in waiting rooms. You're having that experience. And how amazing to have Barbara, Lisa, Gabby in your pocket with their gems, their favorite little tidbits of wisdom coming straight to your phone.
Right. Completely bite-sized on a device that you've probably got in your pocket or in your purse anyway. Mm-hmm. Right? And all you have to do is pull out your phone and then there's that support.
Mm-hmm. I actually really think that at the beginning, everyone was saying, oh, so it's an app. I said, I don't even think it needs to be an app. Why don't we just text people? Like, what is the simplest, easiest way to get support to a lot of people in a very affordable way, and really sort of stuck with text as the way to do that. And more, I think that was the right decision. There's data now about how after 30 days, only 3 people open the apps that they install. And I'm exactly that person. Like, I think it sounds cool. I download it and then I forget it's there and my phone is full of apps.
Sure. Yeah.
Whereas researchers are now talking about the brain response to a text. When you get a text with your name in it, you actually have like a positive feeling. Even before you read it, you just, oh, someone's thinking about me. My person's name is in it. My name's in it. So I think text is actually part of the reason that we have those 95% acceptability rates. Partly it's because we have incredible wisdom from people like Barbara and Gabby and Lisa, but partly it's because text works. It's very simple.
Yeah.
Nothing to install.
You're reducing the friction. Mm-hmm. They don't have to work to get it. Mm-hmm. Mm-hmm. Yeah, it just comes to them and it's right there in front of them.
The Care Plan by Odonata Care has revolutionized the hospice experience by improving the standard of care. This booklet provides education and support to the patient and the patient's caregiver. The Care Plan provides step-by-step directions for caregiving tasks like cleaning or turning a patient. Hospice agencies utilize the Care Plan to support caregivers and to provide critical information in the moment when it's needed. This helps reduce after-hours calls and gives hospice staff more time for patient care. The Care Plan's simple design empowers caregivers by giving them the tools they need to feel confident caring for their loved one. Odonata founders Nancy Hireman and Brenda Kazire also offer a free library of care videos to provide even more support for caregivers. Videos can be found on thecareplan.net or on YouTube. The Care Plan is available in English or Spanish and can be purchased on the Odonata website at thecareplan.net. It's available in paper and digital formats, and bulk purchases are also available for agencies. Purchase your copy of the Care Plan today at thecareplan.net. In a world where compassion and community are needed more than ever, the International Doula Life Movement presents the Tree of Life Conference. Join IDLM November 1st through the 4th in San Antonio, Texas for an extraordinary experience in end-of-life care. The Tree of Life Conference is not just an event, it's a movement towards making a positive impact. Attendees will hear from expert speakers including award-winning end-of-life educator Barbara Carnes, Lisa Paul of the Death Deck, Brenda Kazire and Nancy Hireman of Odonata Care, and end-of-life advocate Helen Bauer, host of the Heart of Hospice podcast. The Tree of Life Conference is more than just workshops and seminars. It's an opportunity to connect, learn, and renew your commitment to compassionate care. This event is made possible by the team at International Doula Life Movement, who believes in the power of empathy, education, and making a difference in the world. Don't miss out on this transformative experience. Join IDLM at the Tree of Life Conference in San Antonio, Texas from November 1st through the 4th. Visit internationaldoulalifemovement.com for more details and secure your spot today.
I want to touch back on something else that you said. You said that it's easy to stop and start them or to stop and restart them. Do people utilize that? Not just because, I mean, we've all had stuff that we want to unsubscribe from and you're like, stop, for the love of God, don't send me anything else. But do you think there are users who are using HelpTexts and they're like, I can't sit in the grief so deeply right now. I don't want to engage for a while. And then later on they come back and like, I think I'm ready to re-engage and I want to restart. Do you get that from your users?
Our data is actually quite phenomenal in this area. So 6 months after signing up, 90% of our subscribers are still getting texts. So at a full year, it's still 86%. So actually, no, people can text back, stop and start, but they don't. They actually renew for a second year, third year. Because I think it's so low threshold and it's a couple texts a week, it's just sort of there for you. You know, we had one teenager who lost her mum to cancer who said, I just wait until after third period. And that's when I read my texts, and I've saved every single one of them. And we have guys who will come into subscribe support. Please help me. I accidentally deleted the thread. Can you resend all the messages? Because those are what I like to have available to read over time. So it's the stop feature is available, but actually not used much. And when it is used, sometimes that's in a really positive way, right? People say, okay, I think I'm ready to take the training wheels off. These texts have been helpful. Thank you. If you only want the text for 3 or 4 months and then you're feeling a little better, then go ahead and stop, and you can come back later if you want to by just texting start.
Very nice. So HelpTexts offers support for a wide age of grievers, is what I hear you saying.
Yeah, 13 and up. So we have a beautiful teen series created with lots of people like Dougie Center, one of our main expert contributors for teenage grief, and also messages for parents supporting a younger child. But we also have very high acceptability rates with seniors. We have lots of subscribers in their 60s, 70s, 80s who, it's a bit of a myth buster. People think that our subscribers would all be young, but that's not the case. Seniors text all the time and actually are very, very, very receptive because it's simple, right? It's not an app. You don't have to download anything. You don't have to do anything. It just comes to your phone.
It's not complicated. Sure.
Yeah. So wide range. Yeah. 13 all the way.
Very nice.
Up to 80s. Yeah.
So can we talk about the support that you're providing for healthcare workers? Because that's near and dear to my heart. And we know, especially in the time we spent during the pandemic, serving in such a harsh and tense environment across the country, and the attitudes that people developed towards healthcare workers. And hospice was not immune to that. Despite society's need for us, we still experience the same biases and the same tension between the roles we play as end-of-life workers and the people we're taking care of. Describe the support that HelpTexts is offering for healthcare workers as they deal with compassion fatigue and burnout.
Yeah. So we work with lots of different kinds of organizations, but the organizations we work with the most are hospices. So although one person can buy a gift subscription or sign up themselves for tech support, most commonly we partner with hospices who have usually a small bereavement team, but a high number of grieving family members that they're trying to support. So then the hospice gifts texts as part of their service. You know, thank you. They put it in their sympathy cards and so on. Thank you for letting us care for your dad. Now we'd like to extend this support for you. People sign up, they get texts from their hospice, and that support goes all year long. So because we were working with a lot of hospices, we very quickly in the pandemic saw that hospices were losing staff, that staff were exhausted. There was just so much happening. So it was actually our hospice clients that asked us, do you have something that could help our team, our employees? So we created HelpTexts for healthcare workers, originally really for our hospice clients. We have messages on, moral fatigue, burnout, self-care, scripts for how to talk to family members when a patient dies, how to take a moment for yourself when a patient dies. Is it normal to have developed feelings for the patient? You know, all of these things. Personalized based on role setting. So if you are working in a NICU, seeing a lot of child deaths. Then we have messages that are customized for that situation, the setting that you work in, the types of deaths you see, your actual role, messages for RMTs, emergency responders, nurses, physicians, administrators, morticians, basically people who are seeing a lot of difficult things at work.
That's wonderful.
We're actually working on, I haven't even announced this yet, but so we created that product for healthcare workers. And then, of course, instantly find ourselves in conversations with people, even like the US Navy, who are saying, well, we want that product, but not for healthcare workers, but for all of us.
Right.
Everybody needs that. So now we're working on a sort of HelpTexts for resilience and well-being that will look at all kinds of different social determinants and challenges that people face to try and provide wisdom and support for everybody who needs it.
Yeah. So basically for humans.
For humans.
Yeah.
HelpTexts for humans. That's a pretty good name, actually. Yeah. HelpTexts for humans.
Make sure I get credit for that if you use it.
It's interesting as well, though, that with the grief support especially, that even the existence of grief support helps to reduce stress on healthcare workers, because so we'll be talking to people that are in a children's hospital, for example. There's one, let's say you have one bereavement person and they have the child dies, the family is bereft and they have nothing to give them. They basically just walk them to the door of the hospital and that's it.
Yeah.
So there's also a huge toll because we have healthcare workers feeling this massive responsibility. They're in this work because they care and they want to provide the care and support that people need, but they can't. They have to turn around and walk into another room with another family in another whole situation. So we also find that when hospices, tissue banks, others provide text support to grieving families and caregivers, even that helps to actually reduce a little bit of that fatigue from the healthcare worker who can now say, okay, well, at least I know they're getting something. Now I know they will get some expert support this year.
Right. It's a horrible burden to be what I call in a helping or a care profession, knowing that you don't have the resources that your families need to send them off, knowing that you didn't give them everything you need. Hospice nurses will understand this. One of the things that causes us to have longer visits is we cannot leave and disengage from a family inside a home until those needs are met. It is very difficult for us to walk away and say, they'll figure that piece out. We don't do that in hospice. We don't do that. We're going to make sure they have every resource they need.
I'm really, really, the stories that we hear, and I'm sure you're hearing the same ones, Helen, just recently, I won't say which hospice, but this was less than a month ago, 2 different nurses took their lives traveling back and forwards from people's homes, going into bereavement situations just in the course of a month. Yeah. That burden is real. And so just giving them a resource that they can offer helps to reduce that burden. And then, as you said, we're now also additionally doing this support for healthcare workers themselves. So we've got a staffing crisis, we've got a mental health and support crisis with healthcare professionals who are just exhausted.
Yeah.
Exhausted.
And it all boils down to we have less to give our patients and their families. We have less time, fewer visits, the whole 9 yards. So HelpTexts is really doing something amazing.
I mean, there's also no training, right?
Yeah, there's no time for that. There's no time for hand-holding, right?
So yesterday I was in yet another meeting with yet another nurse who, has never, ever received any training or guidance about how to talk about death, either to the patient who's dying or to their family members, either when they're dying or afterwards. They don't know. They don't have that training. So we're also working with lots of people we've already got these sort of grief literacy training and tips in the healthcare worker support, because in some ways, yes, it is tips around burnout and so on, but it's also grief literacy and training, because if you feel equipped, it's less stressful. Right. So we can text a nurse and a hospice nurse and say, things that Barbara Carnes helps us to say. People will always remember the nurse who said to them, take care of yourself when you leave here. This is one of the most difficult things you'll ever experience. And we all really treasured having the opportunity to look after John while he was here. Or, script 1, script 2, script 3. Like, there are things that you can say and get used to saying. And the more you feel comfortable saying them, the less stressful it is. And the less you carry that burden when you get in the car and drive home.
Absolutely. So you're supporting not just patients and families and the people providing the care, you're actually supporting the teams that are providing the care, which in turn supports our industry.
I think so, yeah.
Absolutely, because anytime we can reduce burnout and decrease turnover, we want people to stay in this industry. Yeah, that's awesome.
And the mental health toll, and physician suicide, caregiver, like the data around the mental health toll on caregivers is through the roof. We have a few text series that are specifically for military caregivers, people caring for someone who was in the military. That's a lot of TBIs, right? Like brain injuries and so on. And the data around the risk that those caregivers are at the data abounds. So what are the scalable, easy ways that we can support people with even just the smallest, a little thoughtful, in our case, texts, to help them along the way while they're doing these very, very difficult things.
And who knew something so small would have such a big impact?
The humble text.
Yeah, can make or break your day. Isn't that amazing that it has such, I don't want to say power, let's say strength. It has such strength. I want to talk a little bit about your personal story, to touch back on that. So you have a very robust personal bereavement experience. Your work experience was your career you spent in very different arenas than where you're working now. Almost a little bit of a, like they would be at loggerheads. It's technology and touch, which sometimes really butt heads when it comes to taking care of people. How has your experience with grief shaped the work you're doing with HelpTexts?
Well, I believe myself to be living and working at the center of my own Venn diagram at the moment. Every day I wake up and I work, it's hard work being an entrepreneur. This is a company that I sold my house to build. It's not, I work a lot of days and a lot of hours, and every single one of them, I feel that I'm at the exact center doing exactly what I should be doing and bringing together the different parts of my work and life that make sense in this particular way. I've actually always believed that technology does have a positive role to play in building connection and so on. My first web startup was pre-Netscape. To your point, yes, my technology background is, I'm not your typical MIT engineer, that's for sure.
Definitely not. Definitely not.
Even before HelpTexts, I had been doing care coordination apps, suicide prevention, online chats, training teams, using mobile phones to get young people registered to vote. So I believed before my grief experience that mobile and web technology can be used to create true connection. My grief experience then was more like, oh, geez, here's another whole gap that we can contribute to in a positive and productive way that will work. I mean, I wish there was a world where we weren't needed, that everybody's friends and family were supporting them so well after loss, and no one was saying goofy things about don't think about them anymore, or here are those 5 stages and why aren't you on the next one, or you should really get back to work, or it's too soon to be dating. Or, ideally everyone would be getting support from their community. Everyone would have good expertise, and we wouldn't need to be texting people back and forwards.
Yeah.
But that's not the world we're in. We're in a world of escalating mortality rates, decreasing grief literacy, far less people who are trained and available to provide the support in professional settings. So text is just one way to get really good wisdom into people's hands. I think there are lots of examples where technology can do beautiful things.
It is an amazing gift to be able to utilize that. Emma, what's something that someone said to you when you were grieving that brought you a great deal of comfort?
I was very lucky. My sister moved across the country to live with me because I actually wasn't really functioning, you know. This is not exactly an answer to your question, but it's just coming to mind. This is about a year ago. We spent a lot of time crafting each and every text message in the system, hours actually. By the time we work with an expert contributor, craft it, get it small, make sure it works at the sort of 6th, 7th grade reading level. Will it translate into different languages? Works with different pronouns? Is it unique? Has it gone through a thanatology lens? You know, right. So by the time we're actually publishing a new text into the system, it feels like an accomplishment. And we were just finalizing a text that said something like, it was speaking to the difference between moving through and moving on. Like the idea that you have to let go of your person. So because I was young when Barry died, 31, we'd been married for 5 years and together for 12. People were very invested in me moving on, getting over it. Oh, you'll find someone new. Like at his funeral, people were saying things like, well, he had vodka in his salad spinner. I'm like, no. So all of it was this like kind of messy, I don't know, you're asking what was comforting? I don't know. None of it really. Like it was all confusing and exhausting. So last year we were working on this text and it says, the next time you're talking to your friend, remind her that she doesn't need to let go. She can carry her memories of him with her and move through her grief as opposed to moving on. And in the meeting, I said, geez, I wish if someone had said that to me, it really would have made a difference. And I wish that everyone in the world could have this said to them early in their grief. I'll say it again because my phone is still beeping at me. So I was saying to my team, I wish that everyone could hear this. I wish that everyone who is grieving could have this said to them. And my whole team burst out laughing. They're like, Emma, that's literally what we're doing here. We're literally sitting here about to publish this text into the system.
You are getting ready to say this to everyone.
Yes. So that it can go out to everyone. I'm like, oh yeah, right. That's what we're doing. So there are things that are comforting to hear. This is not, the field of thanatology is rich. The caregiver support, there are experts who have all the wisdom. So here at HelpTexts, we're taking that wisdom and putting it into people's hands, into their pockets in the simplest way we know how.
How can my listeners connect with HelpTexts and partner with you, whether they're an individual or an organization?
Oh, we would love that. We love working with hospices. We have lots of amazing hospice clients across the country. We actually had some research published in the Omega Journal last year, which just drew on hospice families, which we're happy to share. It's on our site. So our website is HelpTexts.com. That's plural, HelpTexts.com. And we set up a discount code for your listeners as well. So if you're an individual and you want to buy a subscription for as a gift, we're a great sympathy gift, cheaper than flowers. You can use the code The Heart of Hospice to sign up. And you can buy it as a gift, buy it for yourself. And if hospices are interested in packages of subscriptions for their families, of course, we'd love to hear from them. I'm just Emma at HelpTexts.com and find us that way. That would be amazing.
That's wonderful. Emma, one last question before we go. If you could say something of comfort to someone who's listening, who may be dealing with secondary grief and compassion fatigue as a professional caregiver, what would you offer them right now?
There's so much to say. I worry that sometimes, remember early in the pandemic where we were all like going out onto our porches and cheering?
Yeah, everybody would clap. Yes.
It's like we've gone through this weird cycle where, we were being like supportive, but then it went the other way. And then you worry about seeming trite. Like it's not enough to just say thank you for the work you're doing, and it really matters, because it's more than that. I think it's that we are all trying to do a better job of understanding how difficult the work is, and learning more and more about the challenges, the burdens, and we're here, that we care, and we're looking for ways to provide support that can be meaningful. Basically, that we're listening and learning. I do think there's a lot of that happening at the moment. The best book I read last year was Compassionomics. Just an incredible discussion about healthcare and compassion and the value of kindness and listening to each other and supporting each other, and how a 45-second sentence or two when you're speaking with a patient can be helpful. So I think it's that, hold on, we're learning. There's a lot to improve, but I do think that there's a real shift happening in terms of people's willingness to learn and improve. And that's an important start.
I like that. Hold on. We're learning.
We're learning. Mm-hmm.
I like it. Emma, thank you so much for talking with me today. It's been such a blessing and a joy to have you on the show today.
Oh, thank you. Thanks for having me. Pleasure.
Just one more reminder before we close the episode. Don't forget to go into HelpTexts.com and claim your $10 discount code when you sign up. And remember, the code to use is The Heart of Hospice. Be sure to catch the next episode of the Heart of Hospice podcast. You can find more episodes on theheartofhospice.com, and don't forget to follow us on your favorite podcast platform. You can connect with the Heart of Hospice on Facebook and Instagram, and send your questions or comments by email to helen@theheartofhospice.com. And remember, no matter who you are or where you are in your hospice journey, you are the heart of hospice.
This is the Whole Care Network. Helping you tell your story one podcast at a time.